I think it's going to be a giant fight. I mean, I just can't. I was like thinking of some politic way of answering this. It's going to be a giant fight between all of the different needs and all the different communities. And I actually think that's why it's actually important for us not to go forth just as LGBT, but I keep using the women's health community. They have a lot more power in this fight than we do. So to say, when you're talking about women, what do you mean by that definition? What does that include? It's not just about trying not to get pregnant. There's all these other issues and really making sure they have an expansive definition. So I think it's actually important for us to work through groups that have more power in order to leverage our own voices.
Yeah, I mean, the tension between primary care and specialty care is here to stay. And I think, at least on the HIV side, we primarily focused it around infectious disease specialty versus primary care, but it's also increasingly gerontology, which we haven't really talked a lot about until very recently. But you know, I was looking at some data from DC, for example, that seems to suggest that the higher rate of incident infection these days is in men well over 30 years old, which is very contrary to what I think we thought. First of all, I think we thought that there was a much higher incidence in younger gay men than it turns out that there is, at least in the data that was presented the other night. Point being, they have not only the issues of HIV, but they have the issues that come when you're, 50 plus. And so I think we're just going to have to fight as a community to get the reimbursements up. It's going to be a challenge, though. I'd be very curious to know what Dr. Gold thinks about that. I'll have a chance to chat with her later. Strategize.
What I have to say about that is I don't know whether they're doing a great job of explaining that. That being said, with explanation of benefits, pieces of paper that go out to the person who is paying for the insurance saying, hey, this is what we paid for. Well, and it may not be specific, but there's sort of a catch-22 there as well.
I would also worry about how many LGBT youth are estranged from their family. And while it's great that is for those of us who are not estranged up to 26, for those who are, being on their parents' insurance is just not a viable option.
It isn't going to be free, it's just that they have the opportunity to be on the plan, which might also be out of the reach of the person.
I want to thank you for asking that last question. I'm sorry, we're going to have to wrap up. Because I think that question actually illustrates what all three of our panelists have been talking about, that when you get into the implementation of this law, interesting questions like that happen. And when you don't have someone sitting at the table or talking to the people who are writing the regulations who can think of how this may impact our community, they won't think of it. So as we look forward towards implementation, I guess I have one last question for Rebecca Ernest and Dr. Nguyen, which is if you could recommend that each person in this audience do one thing, and one thing only over the next 6 months, what would that be?
You want to go first?
Please don't, I'll jump in. I'll start. And actually, I'll reiterate something I said before, which is many people don't seek care because of insurance or other reasons. And talking about resilience, what I would encourage everyone in this audience to do is to go seek primary care and get involved with a clinician who's going to meet your needs. If it's at a health clinic, Health Federation clinic, if it's at Mazzoni, if it's at a private clinic, I don't care. But we have to take care of ourselves or we're not going to be able to survive as a community.
And
Okay, and come out to your provider.
Yeah.
And I would also say, off of what Dr. Nguyen said, it's true they hear from people like Ernest and I all the time on Capitol Hill, and they know us, they know our faces, and you actually have quite a bit more power than we do because you actually do put these people into office. And Pennsylvania is a fairly important state. You have Senator Specter, who is less powerful than he used to be, but still a powerful man. And I would say, if you're not already signed up for some kind of action alert system, sign up for it. Sign up for a cause that you believe in and actually call. You may not think that your calls or emails make a difference, but as someone who worked in those offices, they actually do. And we actually had to keep track of them. And then you actually have to get a thank you note, which is nice. And if you don't know anything about any of the issues, you can just call up and say, I want to know what my representative is doing about LGBT health. Just to have someone say the words to them is more powerful than you can imagine. And one person calling, and then you call every week, and then you have your partner and your best friend call, those little voices become a giant wave that they actually cannot ignore.
Well, I'm going to stick my neck out and say that this is an election year, and one of the things that we noticed very clearly through the process, and you know, many books will be written about the healthcare reform debate, but at some point in the process, we as progressive people sort of lost our voice. Suddenly, something that was a no-brainer, that was going to have a public option, that was going to ensure everybody, slowly but surely started getting cramped down into this really small box, into what we have, which is a good first start, but not at all the expansive kind of visioning plan that we had all assumed we were in a position to have because of the political power that and drive that we had behind the election. Now, who has all the energy and focus of attention? It's the other side. And I firmly believe that they do not represent the majority of people. They don't represent the majority of voters. And we need to take back the stage. We've got to figure it out and prove all the pundits wrong. Just as they were wrong that health care reform wouldn't pass, they need to be wrong about what's going to happen in November. We need to make sure that the message that is sent is not that health for all is a bad idea and that people are being punished for providing health care. No, we need to say that for whatever anomaly, these folks have been blowing smoke, and in fact, the folks who voted for health care did not pay a price for supporting what was the right thing to do, and that the people did affirm them at the ballot box, and that's what we can do. That's what we have to do.
One of the byproducts of this town hall will be a white paper that we in the community here in Philadelphia will be able to share with our public policymakers. So when we do make that call, we know what we're asking for, we know what we're saying, and we know what we're going to vote for or against when we go to the ballot box in November. Sellers Dorsey invites you to a reception sponsored by Glamma with support from Pfizer at Stir Lounge. So thank you very much. We really appreciate it. Have a great night.